It's pretty common to get asked about different types of abdominoplasty, which colloquially people referred to as a tummy tuck, but abdominoplasty is the medical term. And there are multiple types, and it really depends on the patient and your particular circumstances as to why one might be recommended over another. And that impacts the extent of surgery and the scar pattern you're left with. So the smallest procedure is a mini abdominoplasty, which involves a shorter scar low down on the abdomen, usually under the undergarments, removing excess skin and fat below the belly button and not repositioning it. An abdominoplasty or a standard abdominoplasty has a longer scar which runs basically from one hip to the other, again attempted to be hidden under your undergarments, and this allows us to remove more skin, and we actually undermine or elevate the skin and fat from the muscle layer all the way up to the bottom of the rib cage, which we call the costal margin, in the midline. And this allows us to produce a more dramatic result, and especially if you're carrying excess skin above the belly button, you would need this. And it also requires us to reposition the belly button. Sometimes we have a radical abdominoplasty where we're also repairing the rectus muscles during pregnancy, or for other reasons they may separate, and that can cause functional issues such as problems with toileting and weak core strength, urinary incontinence. So that can be repaired at the same time in a radical abdominoplasty. In certain patients, especially if there's fullness superiorly, we do a reverse abdominoplasty. This is not as common, and that's where the scar is sitting under the breast folds. There are other kinds of abdominoplasty, especially used in massive weight loss patients, such as the incorporation of a vertical scar. That's called a fleur-de-lis, and that's really because in those patients we have to deal with skin excess in both directions, and by just using one scar it's difficult to not get all that bunching up and dealing with all that excess which is in the transverse dimension. So we can address that with a vertical scar, and in some cases we also have a scar under the breast, making a kind of eye shape. That's called a corset. That's kind of a brief overview, and it really depends on the particular patient, where they're holding the skin and the fat and what you're trying to achieve as to why you might have a different procedure or different scar pattern.